here's Chapter 2, Workforce Safety and Wellness. Our competencies are medicine, infection, disease awareness, assessment and management of. This is still part of the preparatory section. In order to truly and effectively take care of others, you have to take care of yourself first. If you get hurt, you can't take care of somebody else, or if you get sick, you can't really adequately take care of somebody else. So the training that we give you as an EMT is including recognition of hazards, hazards to other people, hazards to yourself, and then being aware of and managing stress in yourself. This is a stressful job. An infectious disease, which is something that we're exposed to a lot, is caused by organisms that enter into the body. A communicable disease can be spread from person to person or from one species to another species. How do you keep yourself safe? First and foremost, immunizations. We are definitely pro immunizations within this field. Protective techniques using personal protective equipment, also known as PPE. And then the number one most important way is hand washing. And there is a skill drill to teach you how to do that effectively. Routes of transmission. So how do we end up picking up these organisms that can make us sick? Direct contact, so you actually getting blood on yourself. Indirect contact, you getting stuck by a needle that has blood on it. Airborne transmission, sneezing. If you haven't, you should look up a YouTube video about sneezing in slow motion, and you can actually see how far those droplets end up spreading. It's actually pretty disgusting. Foodborne transmission or vector-borne transmission. So you're eating contaminated food. Vector-borne is fleas, ticks, that sort of thing that have bit somebody else, and now they end up biting you and infecting you. These are just some examples of direct contact. Airborne illness, you can see that picture right there. I don't know if that's a sneeze or if that's a cough, but truthfully, things do travel pretty darn far. As an EMT, you are going to be exposed to blood, period. There is no EMT in the world that I think that hasn't been exposed to blood at some point. And so part of your training needs to involve handling those blood-borne pathogens and how to safely take care of yourself. The CDC has developed standard precautions that they think that you should take. Hand hygiene is first and foremost the most important. Gloves, we wear gloves on everything. Gowns, maybe. Mask, eye, and face shield protection is appropriate. It doesn't necessarily mean that you're going to wear them on all calls. We definitely need to know how to take care of patient equipment that has been used and is now dirty. Environmental controls, how to take care of textiles and laundry, how to take care of needles and other sharp objects, how to effectively resuscitate a patient while keeping yourself safe, and then respiratory hygiene, cough etiquette, how to try and keep your patients from getting sick from something that you have. On the left, just some of the different types of organisms that end up making us sick, their proper names, and a pictorial representation of what they look like. Proper hand hygiene. I keep coming back to this because it is so important. It's super simple, but it's the most effective way to control disease transmission. we should be washing our hands before and after every patient contact. Does that mean running water? That's definitely the best way, but gel sand or the waterless hand sanitizer is acceptable, except for patients that have a C. diff. That's the only thing that gel sand is really truly not effective against. So, and that's something we can definitely talk about at a later time. But hand hygiene, make sure that you are cleansing your hands appropriately. Gloves, we wear gloves for everybody. It doesn't matter if there's a chance for exposure to blood or body fluids. Gloves, 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 all the time. If it's wet, sticky, and not yours, don't touch it. Put on gloves. Vinyl and latex are effective because so many people tend to have latex allergies. This industry is really moving hard into vinyl and nitrile gloves. There's a special technique for how to remove your gloves, and we can go over this in class, but there also is a skill drill to do this. Basically, glove touches glove. If you have on gloves, just suspect that the outside of the glove is contaminated, whether you've touched somebody or not. So trying to get those off without exposing yourself is important. Gowns provide a lot more protection, especially for extensive blood splatter. However, out in the field, they may not be practical. They may actually expose you to potential for injury because they can get caught. So truthfully, out in the field, I can't remember a time that I've worn a gown. Eye protection and face shields, that's a different story. Anytime there's a risk for blood spatter, you definitely would like to have on some sort of eye protection. You can get the clear goggles that aren't so cumbersome, not like the ones you use in chemistry class, but they're more like sunglasses that are clear. What he has on in the picture is a surgical mask with a face shield attached to it. Those are definitely handy. You can see that it's very probable that some of that spatter is going up and over his face shield. Prescription glasses are not adequate. They don't have enough coverage, and they are far enough away from the face that something can still drip down or leak down underneath of them. So don't think just because you have glasses that you're safe. Mask, respirators, barrier devices. So this is to protect you and or the patient from some sort of communicable disease. The one on the left is just kind of your standard issue surgical mask. You can pinch that metal piece closer into your nose to give you a little more protection. Most effective for fluid spatter. If your patient has a communicable disease, it's just as easy to put a mask on them to protect everybody and your equipment. However, if they're having a problem with their airway, don't put a mask on them. That's just going to make it worse. The one on the right is a HEPA respirator. If your patient has tuberculosis, the simple mask on the left is not going to be effective. You're going to need the HEPA respirator. Mouth-to-mouth resuscitation may transmit disease and is disgusting. There are very few instances that I would ever use mouth-to-mouth on somebody. My kids, yes. My significant other, that's extremely iffy. I just don't know that I'd ever do that. With so many other options, like you can see on the screen, those pocket masks, they have a one-way valve to protect you from the patient. That is definitely the better option. Bag mask devices are definitely something we carry in the ambulance. They deliver positive pressure as well as a higher concentration of oxygen than what you're going to get in the pocket mask. There are proper ways to dispose of and clean, so make sure that you follow guidelines on how to do that. To avoid needle sticks, we don't recap use needles. We don't break needles, we don't bend needles. They need to go into a sharps container. And nowadays, a lot of needles that we utilize have safety devices, but not all of them do. So there are specific containers that you should be putting those in. Make sure that you're doing that. Infection control will be part of your daily routine. You will be protecting yourself from all of your patients. You will be cleaning equipment after every run and then also on a daily basis. When you're doing cleaning, you should be cleaning before you leave the hospital after a call, because you need your rig to be ready just in case you get another call. So cleaning is done after the call at the hospital. Immunity. Just because the germs get to you doesn't mean you're going to be infected. You may be immune, or your immune system may be effective enough to wipe that out before you actually get infected. Immunity kind of determines whether or not you're going to become infected. There are two terms that you should know, The host is the organism that is attacked by the infecting agent, and then there's the pathogen as well. If you've been vaccinated, that gives you a better chance of having immunity to a certain disease. Your preventative measures, maintaining your personal health, definitely increases your chance for resisting infection. If you are exposed to blood or body fluids, if you can turn patient care over to another EMS provider, that may not always be something that you can do, but clean the exposed area with soap and water thoroughly. If you got it in your eyes, make sure that you rinse for approximately 20 minutes to flush out what you can. And then every single ambulance department, somewhere that you work where there's potential to be infected by body fluids, will have a control plan. So make sure that you let somebody know. EMS is high stress. That's just bottom line. That's not a question. That is a statement. That is a fact. It's important for you to know what causes stress and how to deal with it. You definitely need to know what your stress responses tend to be, what your triggers tend to be, so that you can be aware and try and mitigate those. Every time that you are exposed to stress, you go through the same 3 stages. So you have your alarm or response to stress, where you have a heightened awareness. You can go on the flight mechanism when adrenaline starts pumping. You then have your reaction and resistance to stress, and then recovery, which can be exhaustion from stress if you're constantly stressed or have experienced a high amount of stress. Your body does tend to show signs of stress, even if you don't necessarily feel it or you're not aware of it. Some of the signs and symptoms are there on your screen. The cool, clammy skin, you kind of get a little bit sweaty, tensed muscles, increased blood glucose level. That's to make sure that your muscles have what they need in case you're supposed to fight or flight, even if there isn't an immediate threat. Decreased blood flow to the gastrointestinal tract that tends to cause nausea and upset stomach. Situations that are stressful for us in particular, anytime there's a dangerous situation, we put ourselves in danger quite a bit, whether we mean to or not. Physical and psychological demands of our profession, critically ill or injured patients, there are some that no matter what you do, you will not be able to save. We've kind of been taught growing up that if you call 911, somebody is going to show up and somebody is going to save you. And you'll find through this profession that it's not that easy, that some patients are beyond saving, no matter what you do. Dead and dying patients, you will come face to face with death in this career at one point or another. Overpowering sight, smells, and sounds. Body fluids are abundant in this career. That's just what it is. We expose ourselves to some nasty situations, and it's just something you end up learning to deal with, truthfully. Multiple patient situations can be extremely stressful, especially if you don't have the proper resources to manage all of those patients. It can seem very, very overwhelming. Angry, upset patients, family, and bystanders. People don't react to situations calmly. I mean, that's kind of goes without saying. But when tensions run high, people tend to react without thinking. And even though you're there to help, you may be the person that they end up targeting for all of their stress, their frustration, their anger. Not necessarily that they mean it, but it just happens. The unpredictability and the demands of EMS itself, this is not an easy career. Very, very rewarding, totally worth it, but it's rough. Non-critical, non-911 patients, the majority of the calls that we run on a daily basis are not for true emergencies. What our patients deem an emergency and what we as EMS deem as an emergency are very, very, very different things. Sometimes you start to feel more like a glorified and very expensive taxi service than a true ambulance EMS worker. It gets very stressful some days when you've been running call after call after call, and truthfully, none of them needed an ambulance. So trying to deal with the compassion fatigue that ends up cropping up in our career. So acute stress reactions occur during the stressful situation. We tend to do a good job of bottling up our emotions and not getting stressed in the moment. Normally what we end up dealing with is a delayed stress reaction. Once you're not in that situation anymore, all of a sudden you have a chance to think about it, and that's when you have a stronger reaction to it. And then cumulative stress reactions, prolonged or excessive stress over and over and over will take its toll on you. PTSD is huge in this career field. Post-traumatic stress disorder, it can develop. We have tried to come up with ways to prevent PTSD from happening. PTSD is having flashbacks, having daily disturbances to your life because of a situation. So what we ended up doing, we come up with critical incident stress management to develop or to decrease the likelihood of developing PTSD. So after a particularly stressful call incident, you can either do an informal debrief or you can do a formal debrief where you actually have a professional come in and guide you through that. Warning signs of stress. Everybody reacts to stress differently, but some of the more common signs is just irritability towards everybody, inability to concentrate, sleep difficulties, either sleeping too much or not being able to fall asleep, feelings of sadness, anxiety, or guilt, indecisiveness. You just can't make a decision irregardless of how easy it may be to make it. Loss of appetite can also go the other way of eating too much. Loss of interest in sexual activities, isolation, just kind of withdrawing from everyone around you, loss of interest in work, especially if work has been something that you enjoy doing or other activities that you enjoyed doing. Now all of a sudden you're kind of meh about it. Increased use of alcohol or recreational drugs. This is pretty prevalent in our field. Trying to numb the pain rather than deal with it, definitely not recommended. And then you can actually have physical manifestations of psychological issues. So chronic pain, headaches, backaches. You can actually have reactions that are so powerful that they can cause even stroke-like symptoms. Strategies to manage stress. So minimize or eliminate your stressors if you can. If you have an issue with your partner, negativity, hostile personalities, you can request to change partners. It's easier if you communicate with that person and try and come to an understanding, but if you can't, a potential change may help. Change your work hours. This may or may not be an option. Change your work environment. Cut back on overtime. In the medical field, we always feel like we have a duty to serve others. It's inevitable that when you get new people on the ambulance, they have such zest for this profession that they tend to pick up all the hours that they can, and they feel obligated to cover uncovered hours. Everybody does it, but make sure that you take care of yourself first and foremost. Changing your attitude about the stressor, trying to talk about your feelings. We are not great about that in this field. We tend to act like we don't have emotions. Definitely not the best way to go about it. Seek professional counseling if needed. It is not weak to get help. If you want to last in the medical field, especially in pre-hospital care, you have to take care of yourself before you get a host of problems. So definitely worth it to seek help if you need it. Try to adopt relaxed philosophical outlook. I got this, it's fine. Philosophical outlook. That may just be a personality thing that you don't have, but you can adapt, you can change. Expand your social support system. We tend to hang out with people like us because we are a special breed. But if you have more people that you can lean on, more people you can ask for help, that's definitely going to help you out. Sustain your friends and interests outside of EMS. Those that really truly like this field, it tends to be something you eat, sleep, breathe, EMS. You need to remember that that's not all you are or all that you do. try to minimize your physical response to stress. Deep breathing sounds ridiculous, but it actually does work. Deep breathing reduces the amount of epinephrine in your system, which is what causes that adrenaline rush, that fight or flight response. It actually can reduce it. When you get high levels of epinephrine in your system, you actually lose the ability to think critically. You know, those people that get super stressed out or get into a situation and they just freeze because they can't think about what's going on, that's due to high levels of epinephrine in the system. Deep breathing actually helps with that. Periodic stretching, regular exercise will definitely help. You need to eat right, get exercise, and sleep. Those are 3 things that do not come easily in EMS. Sometimes you eat what you can when you can. Exercise, relaxation don't generally come naturally to pre-hospital care providers. And sleep, regular and uninterrupted. We do shift work, 12-hour shifts most of the time. If you work in a fire-based system, sometimes they do 12 or 24-hour shifts, excuse me. And so trying to get regular and uninterrupted sleep is about impossible, but that's what you should strive for anyways. Disease prevention, knowing what your family's health history is so that you can try to keep from adding risk factors onto that. Adjust your lifestyle as can. If you don't smoke, don't start. If you're not an alcohol drinker, it's just easier to not make that part of your routine. And then making sure that you have balance between your work, family, your health. Take time off if you need to, and when you need to. If you feel like the stress at work is more than you can truly handle, get help. We'll go ahead and take a break here and then come back and finish in tape 2, recording 2.